One morning, your heart can beat differently. Not faster, not stronger, just somehow wrong. And most people won't panic at that moment because they'll think it's fatigue, stress, or coffee. But this is exactly how the stories doctors hear every day begin. Stories that arrive when it's already too late. The heart is not a symbol of love or a poetic metaphor. It is a pump that works non-stop, pushing blood through your body. And when the pressure inside the system stays high for years, the pump wears out just like any machine under constant overload. The danger is that high blood pressure almost never hurts. It doesn't scream or warn you. It works quietly, methodically, destroying blood vessels, the brain, and the heart itself while a person lives a normal life and considers themselves healthy. There are men and women who wake up for years with mild headaches, blame it on weather, stress, or lack of sleep, when in reality, it's a signal that their blood vessels are experiencing pressure they were never designed to handle. The heart has four chambers that work as a precisely synchronized system, but when blood pressure is high, the left ventricle is forced to pump with extra force. Over time, its walls thicken, lose elasticity, and begin to function worse, even though the person may feel nothing for years. That's why heart attacks often happen to people who were working, laughing, and feeling fine just yesterday. There was a woman, let's call her Olena, who always thought she was strong. She worked without days off, drank coffee instead of eating, went to bed late, and never checked her blood pressure because I'm still young. One day she felt extreme fatigue, not pain, and decided to lie down. An hour later, she was in intensive care with an acute heart condition. Doctors later said her blood pressure had been high for many years. Her body had simply stayed silent. The heart doesn't have pain receptors that warn you in advance. It just keeps working until it can't anymore. The most dangerous thing is that high blood pressure damages not only the heart but also the brain, eyes, and kidneys. Often the first real symptom is a stroke or sudden vision loss, when it's already impossible to turn everything back. People think heart problems belong to old age, but modern lifestyles have turned them into a problem of people in their 30s and 40s, when the body still looks strong on the outside but is already operating at its limit inside. When you live in constant stress, sleep too little, and eat on the run, the heart doesn't adapt to it. It slowly wears out, like an engine without maintenance. Blood pressure is not just numbers on a monitor. It is the force with which blood hits the walls of your vessels. When that force is constantly too high, vessels lose their ability to properly expand and contract. The heart receives less oxygen, and the brain faces higher risk. That's why many people experience anxiety, panic attacks, and chronic fatigue without realizing the cause may not be psychological, but physiological. The heart and nervous system are tightly connected, and when one starts to malfunction, the other follows. There are stories where people treated anxiety for years, while the real cause was uncontrolled blood pressure. And the scariest part is that most of these stories could have been stopped much earlier if someone had explained that the heart doesn't give second chances as often as we think, and that ignoring blood pressure is not a small mistake. It's a slow gamble with your life. The most dangerous thing about high blood pressure is that it doesn't ruin your life instantly. It does it slowly and almost invisibly. A person wakes up in the morning, goes to work, laughs, makes plans, while at the same time their heart is working under constant overload. Imagine a pump that is forced every day to push water with twice the pressure it was designed for. At first, it manages, then it starts making strange noises, and eventually, it breaks. That's exactly how the heart works under high blood pressure. When blood pressure is elevated, the heart must push blood through vessels that have already lost their elasticity. Blood hits the vessel walls harder than it should, leaving microscopic damage. The body tries to repair this damage, and over time, the vessels become stiff, narrow, and more dangerous. The heart is forced to contract with greater strength, and the left ventricle gradually thickens. From the outside, this looks like adaptation, but in reality, it's a trap. A thickened heart muscle relaxes worse, fills with blood poorly, and gets tired faster. A person starts to feel shortness of breath while climbing stairs, strange fatigue, pressure in the chest, but often doesn't connect it to the heart. There was a man, let's call him Serhi, who for years felt that something wasn't right, but always found excuses: age, work, stress. He never measured his blood pressure because there was no pain. One day he felt extreme weakness and dizziness, but instead of seeing a doctor, he went home to rest. That night, he had a heart attack. Doctors later said his heart had been working at its limit for a very long time. He just didn't know it. The heart doesn't warn you with screams, it warns you with silence. High blood pressure slowly destroys the coronary arteries, the ones that supply the heart with oxygen. When they narrow, the heart muscle literally starts to suffocate. That's why many heart attacks happen suddenly, without classic pain, only with sudden weakness, nausea, or cold sweat. And the most dangerous part is that people often ignore these signs. Blood pressure is not just a number on a monitor. It is a signal of how fast your heart is wearing out right now. And every day it remains uncontrolled, the heart pays for it with its strength. It is the force with which blood hits the walls of your vessels. When that force is constantly too high, vessels lose their ability to properly expand and contract, the heart receives less oxygen, and the brain faces higher risk. That's why many people experience anxiety, panic attacks, and chronic fatigue without realizing the cause may not be psychological, but physiological. The heart and nervous system are tightly connected, and when one starts to malfunction, the other follows. There are stories where people treated anxiety for years, while the real cause was uncontrolled blood pressure. And the scariest part is that most of these stories could have been stopped much earlier if someone had explained that the heart doesn't give second chances as often as we think, and that ignoring blood pressure is not a small mistake. It's a slow gamble with your life. The most terrifying stage begins when high blood pressure reaches the brain because the brain does not know how to scream for help. It simply starts losing function, and for a long time, a person doesn't understand what is happening to them. The blood vessels in the brain are extremely thin and delicate. They were never designed to handle constant high pressure. When blood hits their walls with excessive force for years, the vessels gradually become damaged, narrowed, or rupture, and in that moment, a person's life can split into before and after. A stroke rarely looks the way movies show it. Often, it's not sharp pain, but strange weakness, confusion, speech problems, facial drooping, or a feeling that the body stops obeying commands. Many people do not call an ambulance because they think it's fatigue, stress, or low blood pressure, and those minutes become fatal. There is the story of a woman named Natalia. She was 39, worked constantly, slept very little, and often experienced ringing in her ears and brain fog, but considered it normal for her lifestyle. One morning she couldn't pronounce words clearly, but decided it would pass. Hours later, she was hospitalized. The stroke had already done its damage. Some brain functions never returned. High blood pressure acts like a slow poison to the brain. It disrupts blood supply, deprives brain cells of oxygen, and causes them to die, a process that can continue for years without a dramatic collapse. That's why people with uncontrolled blood pressure often complain about memory loss, poor concentration, irritability, and sudden mood changes. This is not personality or age. It is a brain operating under constant deficit. When brain vessels are damaged, the risk of microstrokes increases, small injuries that go unnoticed at first but accumulate over time and lead to cognitive decline. People begin to forget simple things, get lost in familiar places, struggle to make decisions, yet they don't connect it to blood pressure because they expect pain, and there is none. Vision often becomes another victim of high blood pressure because the vessels of the retina are among the thinnest in the body. When they are damaged, vision starts to deteriorate, floaters appear, blurring, sudden flashes of light. People visit eye doctors and change glasses without checking blood pressure, even though the problem doesn't start in the eyes, but in the vessels. The harsh truth is that high blood pressure can slowly destroy the brain and vision without giving any clear warning, and the first real symptom may be irreversible. When a person learns to speak or walk again after a stroke, they often remember years of small signals they ignored. High blood pressure does not ask if you are ready, it simply waits until a vessel fails. And that is why ignoring blood pressure is not a small mistake. It is a risk of losing who you are. It is the force with which blood hits the walls of your vessels. When that force is constantly too high, vessels lose their ability to properly expand and contract, the heart receives less oxygen, and the brain faces higher risk. That's why many people experience anxiety, panic attacks, and chronic fatigue without realizing the cause may not be psychological but physiological. The heart and nervous system are tightly connected, and when one starts to malfunction, the other follows. There are stories where people treated anxiety for years, while the real cause was uncontrolled blood pressure. And the scariest part is that most of these stories could have been stopped much earlier if someone had explained that the heart doesn't give second chances as often as we think, and that ignoring blood pressure is not a small mistake. It's a slow gamble with your life. The most dangerous lie people believe for years is very simple. I'm just tired. These are the exact words doctors hear most often from patients who later end up in intensive care. Constant fatigue is not normal, but modern life has taught us to accept it as standard. People wake up already exhausted, drink coffee to start the day, another to survive until lunch, and another just to stay awake behind the wheel or in front of a screen. They feel chest tightness, strange heart palpitations, anxiety without a clear reason, yet convince themselves it's stress, work, responsibility, or age. The problem is that the heart and blood vessels do not distinguish between psychological stress and physical danger. For them, it is the same signal. Threat. When a person lives in constant stress, the body releases hormones every day that raise blood pressure and force the heart to beat faster. If this lasts a week, the body copes. If it lasts months or years, the heart begins to break down. Many people seek help for anxiety, panic attacks, and the feeling that their heart is about to jump out, and spend years treating symptoms without ever checking their blood pressure. There is the story of a man named Ihor who was 44. He considered himself emotional, often felt anxious, woke up at night with a racing heart, but routine tests showed nothing critical. He was advised to rest, change jobs, and stress less. One day, he collapsed on the street. The cause was a sudden spike in blood pressure and a heart rhythm his body could no longer control. His heart was not weak, it was exhausted. Chronic fatigue is often the first sign that the heart can no longer supply the body with oxygen the way it used to. When vessels are narrowed and pressure is high, blood reaches the muscles and brain less efficiently, and the body lives in a constant state of energy deficit. People begin to forget words, struggle to focus, become irritable over small things, and assume it's personality. In reality, it's physiology. A heart working at its limit cannot give more. The harsh truth is that many deaths from cardiovascular causes happen to people who spent years saying, "I'm just tired," and never asked why that tiredness never went away. Fatigue is not weakness, it is the body's language. And when it is ignored for too long, the heart stops speaking altogether. And that is why ignoring blood pressure is not a small mistake. It is a risk of losing who you are. It is the force with which blood hits the walls of your vessels. When that force is constantly too high, vessels lose their ability to properly expand and contract, the heart receives less oxygen, and the brain faces higher risk. That's why many people experience anxiety, panic attacks, and chronic fatigue, without realizing the cause may not be psychological but physiological. The heart and nervous system are tightly connected, and when one starts to malfunction, the other follows. There are stories where people treated anxiety for years while the real cause was uncontrolled blood pressure. And the scariest part is that most of these stories could have been stopped much earlier if someone had explained that the heart doesn't give second chances as often as we think, and that ignoring blood pressure is not a small mistake. It's a slow gamble with your life. There is a moment that almost no one talks about out loud, yet it decides everything. The point when the body is still holding on, but already operating on its last reserve. At this stage, a person looks normal. They go to work, communicate, make plans, but inside, the heart and blood vessels no longer have any margin left. This is where the greatest tragedy happens, because the person still has a chance, but doesn't know it. High blood pressure and heart disease rarely give clear deadlines. They don't say, you have 1 more month. They simply accumulate damage day after day until one moment the body can no longer cope. Many people suffer heart attacks or strokes not because they ignored obvious symptoms, but because the symptoms seemed too small to matter. Mild shortness of breath, strange weakness, poor sleep, nighttime palpitations, pressure in the head, anxiety without a clear reason, all of this becomes background noise of life instead of a warning signal. But the heart has no backup version. When a vessel fails, there is no time left to think. And the most painful part is that after a catastrophe, people often remember years when their body tried to speak, but they didn't listen. Understanding this changes the way you see health forever. Not through fear, but through clarity. Most cardiovascular disasters are not random. They are the result of long-term neglect. If you want to understand what's really happening inside your body before it's too late, subscribe to this channel. Here, I explain in simple words what most people ignore for years, because knowledge is not a guarantee, but it is a chance. A chance to pause, to check your blood pressure, to change your pace of life, to give your heart the ability to work without constant struggle. The heart can recover, but only when it is no longer pushed to its limits every day. Sometimes the most important decision is not treatment, but attention. Attention to signals that do not hurt but matter. Because the absence of pain does not mean the absence of a problem. And those who understand this in time often gain the most valuable thing of all, time and life. And that is why ignoring blood pressure is not a small mistake. It is a risk of losing who you are. It is the force with which blood hits the walls of your vessels. When that force is constantly too high, vessels lose their ability to properly expand and contract. The heart receives less oxygen, and the brain faces higher risk. That's why many people experience anxiety, panic attacks, and chronic fatigue without realizing the cause may not be psychological, but physiological. The heart and nervous system are tightly connected, and when one starts to malfunction, the other follows. There are stories where people treated anxiety for years, while the real cause was uncontrolled blood pressure. And the scariest part is that most of these stories could have been stopped much earlier if someone had explained that the heart doesn't give second chances as often as we think, and that ignoring blood pressure is not a small mistake. It's a slow gamble with your life.